Hey guys, it's Friday, January 22nd. It's the end of the first week of my new term, which is Nursing 203 GIGU, and we started cancer this week. We talked about benign and malignant tumors. We talked about metastasis, neoplasms, sarcomas, different carcinogens that can cause cancer. Smoking is very bad for you, in case you didn't know. That's one of the most talked about topics to prevent cancer. You want to quit, you don't want to start, all that good stuff. And we also talked about different treatments for cancer. The class came up with the acronym CRIS, C-R-I-S, which C is chemo, R is radiation, I is immunotherapy, and S is, of course, surgery. We also came up with another acronym, STD, for any patient that is receiving radiation. You want to get in and get out, and you always want to make sure that you're shielding, time, and distance. STD, those are the three most important things when you're dealing with a patient receiving radiation. You don't want to be in there any longer than you have to. And we talked about how x-ray techs are more prone to getting leukemia because they're around so much radiation, being in that environment all the time. And clinical, we received our new patient. My patient is very nice. He had a spinal fusion on his L4 through S3. We haven't really talked about all those lumbars and stuff, so I can't remember that far back to anatomy. But he also had foot drop in the right foot, but he is working with physical therapy. He has recovered. He's doing fairly well. He just has to work on being able to walk again. He's very pleasant though. He answers all my questions. He's fine with me doing my assessment on him and taking his vitals, so he's very cooperative and I'm very appreciative of that. But that's really all we've talked about this first week. We have a sim lab coming up on Tuesday. We're going to be doing a Foley sim. Our teacher is going to refresh our minds how to keep sterile technique while inserting a Foley, and that's pretty much all we've done so far in the first week. It's going very well. I also got very good news yesterday. I have a job interview on Monday. The store, hopefully if I get the job, is literally a 10-minute bike ride from my house, obviously since I can't drive for 6 months. So I'm very excited. I hope I get it, and I will definitely let you guys know if I do get it. So it's Friday. I'm not doing anything this weekend. We're having a bunch of nasty, cold, wet weather. We have mixed precipitation, snow, rain, sleet, everything. So I'm just going to relax this weekend, get a bunch of homework done so that I can be ahead and get ready for the week. Hey guys, it's Wednesday, January 27th. I just got home from clinical. Last mod, our clinical was only 6:30 till about 3:30. This mod, I don't know if it's because it's a different unit and it's more extensive, that we're there 6:30 till 4:30. We got out a little early. It's only 4:36. So I got home a little bit early today. Today at clinical was very exciting, very productive, and a very good learning experience for me and my classmates. Jets are flying, so I apologize if they fly over while I'm talking. So today I did 2 wound care dressing changes. The first was just a stage 1 on my patient on his sacrum, and then the next was stage 3 sacrum pressure ulcer, and it was very bad. She had necrotic tissue, green and yellow pus mucousy areas, and it was kind of scary. But you know, it's part of the job, and it was a learning experience for me. I used the simple saline solution to cleanse the wound. We put some bacitration type ointment on the open wound, and then we covered it with the pink tape type of bandage. I forgot what they're called, but that was fun. And I also used the Hoyer lift. I administered medications, and then my favorite part of today, which I completely love, that's all I've talked about since I've done it this morning, I gave IV antibiotic piggyback through a PICC line, and it was the funnest thing I have done since starting this program, and you can tell because I'm so excited about it. So basically the nurse helped me set up the machine. She showed me how to flush the PICC line with the saline solution, and she taught me the acronym SASH. Anytime you're administering IV antibiotic piggyback, you want to use that acronym. You want to flush with saline, then the antibiotic, then flush with more saline, and then the heparin. You never want to give heparin before saline. So basically it was like a vial of antibiotics attached to a saline flush bag type thing, and you break the little tubing that goes into the vial, which allows you to squeeze the saline bag and get it in the vial of the antibiotic. You switch that around and kind of make it dissolve and mix up. Then you flip it over. You press all the air back up into the little ampule vial of antibiotic, let go, and it drips right back down into the bag. So then we went in the room and she showed me how to set up the actual machine that helps administer it. She showed me how to set up how many mLs per hour and all that good stuff, and it was just so fun. For the first time since this program, I felt like a nurse, because CNAs don't mess with PICC lines like that. So for me to actually do a nursing skill, I have never got so many things checked off on my CAR, which is our competency achievement record for the school. You have to have it all filled out before you graduate. I got so much stuff signed off today, and it was just such a good learning experience, and I can't wait, because this week coming up, on Monday and Wednesday we have clinical twice, as opposed to this week and last week we only had it on Wednesday. So we have 2 days of clinical next week and 2 days of clinical the week after, and I'm so excited to do more. I love wound care, and I obviously love doing IV antibiotics. So that's pretty much all we did today. We got our case study information for our presentations that we have at the end of the mod, and basically we took our cancer test. I got an 87 on it because the dosage calc problems that were on there kind of stumped me, so I need to brush up on my dosage calc. I did good on the tablet questions. I just have to brush up on my kilogram and milliliter per hour questions. Those are the ones that always get me. And then we're getting ready to start talking about GU, I believe. Chapters 28 and 29, I think. So, yeah. But today was a great day at clinical. I'm so excited. I'm off tomorrow, and it's my birthday, so I'm going to go out to eat with my mom. And hopefully the rest of today will be happy and positive like clinical was. And yeah, I'm so excited to become a nurse. 207 days left until I'm done with the program and I graduate, and I cannot wait. So it is Tuesday, February 2nd. I just got home from class. Today we basically went over GI disorders like ulcerative colitis, Crohn's disease, a complete bowel obstruction, types of colostomies like a single barrel, double barreled, a loop colostomy, and diverticulitis, diverticulosis, and diverticula. If diverticula is present, they have diverticulosis, not itis. Itis is just inflammation. And we also had a sim lab today on acute abdomen, which is when they get pretty much rushed to the doctor or ER for acute sudden onset pain in their abdominal area, and it's been recurrent for the last 24 hours. So we did a sim on that, how to manage their pain, and then we also refreshed our memory on how to insert an NG tube. You measure the tubing from the nose to the ear to the xiphoid process, and then the 3 ways to check to make sure you're in the stomach is the x-ray, aspirate the pH and test it, and then auscultate the whooshing of the air after you administer it into the tubing that goes into the stomach so you can hear it. That's basically all we did. I have clinical tomorrow. I'm actually about to get picked up for my training that I have at my new job. I don't know if I told you guys I got it, but I did. I got a new job 5 blocks away from my house. My aunt is going to pick me up and take me. I have a quick training seminar for like an hour, and then tomorrow I'll train some more after clinical, and then I'll be training during the weekend Saturday and Sunday for like 2 or 3 hours, and then hopefully they'll put me on the schedule once I'm in the system. I'm very excited. My patient that I had at clinical got discharged yesterday, and tomorrow I'm pretty sure my instructor is going to give me a new patient, hopefully. The unit we're on is really small. There's 9 of us in our clinical group, and there were 9 patients yesterday, and mine went home, so now there's only 8. So I don't know what's going to happen at that facility between, yesterday, today, and then by the time we get there tomorrow morning. But hopefully they'll have enough patients for all of us. If not, I'll float and help everybody, or I will maybe get transferred to the other unit with the other half of the class that's over there and hopefully get a patient. They'll work it out. But I hope you guys have a great Tuesday, and hopefully tomorrow after clinical, if something exciting happens, I will document it. Hey guys, it's Monday, February 8th. I just got home from clinical. The jets are flying very bad today, so if you hear them flying over while I'm talking, I've literally filmed this 15 times now and I'm not stopping. So yeah, I had a new patient today, and with that, I administered my first dressing change for weeping edema. There were full thickness wounds on the heels of the feet because the patient was diabetic, so we had to administer the dressing change on the feet, and then we put it's like Xeroxafin, the yellow wound bandages that are like soaked in Vaseline type gel. We put that on top of the edema, and then we put the abdominal pads around it, and then we put the Strilex white bandaging around it, and then we of course initial dated and timed it when we did that change. And I also administered finasteride for the first time, and I had to write that down because I didn't want to forget what it was. It's a type of testosterone supplement, and women of childbearing age, especially pregnant women, obviously with a fetus in the womb, you don't want to touch that pill with your bare hands. It can affect your hormones, and if you're pregnant, it can affect the fetus. So I had to double glove, punch it through the blister pack, and then of course give it to the patient. And it was kind of intimidating because you think like, oh, it's just a little pill, but it can do so much bad things to you and your hormones, and especially to your fetus if you're pregnant. So I was very glad to get in and get out. We basically just had a really quick day today at clinical. It was, do the ADLs, give your medicine, and then the weeping edema dressing change came after lunch. And then after that, we worked on our nurse's note and our concept map with 3 NANDAs and 5 nursing interventions with a patient response / goal. And that's really all we did. We have clinical Wednesday, and then the following Wednesday is our last clinical, and then that Friday is our final for nursing 203, and then we're on to cardiac. So the program is really just moving right along. I'm excited. I'm learning more and more every day at this clinical site, and yeah, today was a good day. Hey guys, it's Friday, February 12th. I just got home from class yesterday, and today we pretty much just talked about disorders and diseases of the GU system, like cancer of the kidneys, the cancer of the bladder, cystitis, glomerulonephritis, and nephritis, and types of treatment for cancers, which is, getting a nephrectomy if you necessarily have to, and using chemo, radiation, and kinds of medications for cancer. And basically we just learned the structures and the most important part of the GU system, which is of course the kidneys, the ureters, the bladder, urethra. We also talked about the liver. We talked a little bit about the gallbladder and pancreas, but for the most part pancreas is what we talked about in our diabetes mod. But yeah, that's basically all we did. We've pretty much just been discussing major diseases that are popular because Monday has been reserved for us to present our case study all day. And basically our case study, we choose a patient from our clinical site that has something wrong with them. Like I chose to do chronic kidney disease on my patient that I had like my second week there. And basically I just have to do the pathophysiology of the disease, actual and potential signs and symptoms of the disease that that person may have had or could have had, their lab values, the type of medications they're on, my patient teaching, like what I could teach the patient about the disease or help improve with the disease, their admitting diagnosis, if it's different than what they're being treated for, their history, height, weight, all that good stuff. So the whole day on Monday is going to be reserved for us to present about our patients, and basically the teacher wants to be able to paint a picture of that patient when we're explaining what's on our case study. So that's what I'll be working on this weekend, and as far as my weekend goes, that's all I'm going to be doing is homework. Our final is next Friday, so everybody's really excited because it's the end of the mod, and after this we go to cardiac and we'll be in the hospital, so that's what everyone's looking forward to, and we're 190 days closer to graduating. Hey guys, it's Tuesday the 16th. I didn't vlog yesterday after class because I was just so tired and annoyed, and today was not a good day either. Yesterday we just presented case studies all day long. For those of you who don't know what that is, or if your school doesn't require you to do them, we basically have a diagnosis from the patient we have at clinical. There's a jet flying over, sorry. And since we're in GIGU, my patient had chronic kidney disease, so I have to go through and list 5 interventions for him, the rationale and the response. I have to do the patho on CKD. I have to do safety measures for that patient, write all the medications, all of the labs, and it's just a draining process to listen to everybody talk about their patient for a whole 8 hours, minus the hour lunch break we get. So today we finished presenting some of the people that weren't there. They got to go today. And we also took another Kaplan. I failed, and it pissed me off because the clicking of the mouses and people were talking to the teacher while I'm trying to test, and people are like banging their feet against the chairs and rocking back and forth in the computer chairs and stuff. It was just very distracting and annoying to me. So I ended up failing with a 63. You're supposed to get a 70 or above because it's a 10-point conversion. So I got a 63, so technically I got like a 73. That brought my average from a 93 down to an 82. Our final is Friday, so hopefully I pass the final. If not, I'm screwed. Don't know if I mentioned it from my psych mod, but I did fail that psych Kaplan as well, which like 95% of the class did. Only 3 out of 20 people passed it. It was very difficult. We watched the videos on Kaplan, we went over the material we were told to go over, and when we took the psych Kaplan, it had nothing to do with anything we studied. It was all about dementia and like therapeutic communication. None of the drugs we studied were on there. None of the other like psychotic disorders we studied was on there, so everybody was pretty pissed about that. So today when I failed another Kaplan, I was just really annoyed, and then I came home and checked my mail. My landlord, where I pay rent, because technically I'm behind 2 months and I've been trying to catch up the best I can without having to get my boyfriend to pay it. Yeah, we're behind $1,320, and if I don't pay it soon, I'm going to get evicted and blah, blah, blah. And yeah, today's just not a good day. I'm over it. Tomorrow is our last day at clinical, and then Friday is our final. So hopefully I pass. If I don't, I'll retake the class. It wasn't a hard class. It wasn't a boring class, but I'm really hoping that I pass the final so that I don't have to waste time retaking a course and then pushing my graduation date even further. Hey guys, it's Friday, February 19th, I believe. I just got done taking my final for GIGU and I passed! I'm so excited. That means I get to move on to the cardiac mod, and that is very exciting. So basically this mod, we went over oncology, which is cancer. We learned about carcinomas, sarcomas, neoplasms, and then once we started talking more about the GIGU systems, we went over cancer of the stomach, cancer of the rectum, the pancreas, the bladder, the kidneys. We talked about acute renal failure, chronic renal failure, end-stage renal disease. We also talked about how to prevent UTIs. ladies, you always want to wipe front to back. You want to pee after intercourse and before, if possible. And you want to constantly stay hydrated and push some fluids. You also don't want to douche. Douching is very bad for you. It messes with the good pH in your vagina and it kills the good bacteria, and then that's how bad bacteria can get up in there and give you a UTI. We also learned that the most common type of kidney stone that women get is the struvite, which has to be surgically removed, and then you'll be put on an antibiotic therapy regimen. We learned about how to take the antibiotics, you know, when you are diagnosed with the UTI after you have a urinalysis. We talked a lot about BUN and creatinine for the kidneys to assess if your kidneys are functioning correctly. Acute renal failure is reversible. Chronic renal failure is not. Yeah, and we learned that Kegel exercises are very important. Men can do Kegels. I already knew that, but the majority of my class did not know that, so when my teacher threw that information out there, they were like, what? Yeah, I knew they could. I always do Kegels, especially at stoplights, but basically, you know, if you want to teach a man how to do a Kegel, just tell him to pretend he's going to urinate and then stop the flow, and then continue to urinate and then stop the flow. Yeah, that was an interesting thing to learn because the whole class, their mind was like literally blown. But we talked about that, and that's pretty much all our test was on today, was how to prevent UTIs, because UTIs are very, very common in women because our urethra is 3 to 5 centimeters and a man's is like 20. So it takes longer for the bacteria to travel up their urethra and get into their stream and give them an infection, as opposed to us, since our urethra is very close to our anal area, and that's where the E. coli bacteria can just climb up in there and give us that UTI. So preventing UTIs is very important. And we talked about how it's important to finish your antibiotic therapy even if you're feeling better. You want to take the whole dose, the whole course of antibiotics. Even if you start feeling better after day 3, you take the full course of the 7-day treatment or whatever they give you. So yeah, I'm moving on to cardiac. 185 days until we graduate, and I could not be more excited. This mod, especially at clinical when we did the heparin shots and all the treatments and wound cares, I really felt like a nurse. And I love getting excited about talking about it because I know I'm in the right field. I know I love what I'm going to do when I graduate and pass the NCLEX, hopefully on the first try. And I'm excited for cardiac. We start that Monday. We're going to have clinical Monday, Wednesday, 6:30 to 3, and then we're going to have class on Tuesday, Thursdays. And I went to my job today to talk about working at my assisted living facility again, and we're going to kind of work out a schedule with me. So today has been a great day, and it's Friday. So with that being said, I hope you guys enjoy your weekend. I know I am. I'm going to clean a little bit, rest a little bit, and just get ready for my new mod.